details from the ground. I'm being joined by Bharti Chaturvedi, who's the air pollution expert, who's also the founder and director of Chintan Environmental Research and Action Group. I'm also being joined by Dr. Rahul Chandola, who's the founder and of the Institute of Heart and Lung Diseases. Let me rope in Dr. Rahul Chandola. So, and of course, the important factor is that several people, healthy people in fact, are also facing issues with their throats and with their eyes burning because of the pollution. But you think at this point the immediate solution also needs to be brought about for people already having a predisposition for respiratory issues who are in hospitals?
Yeah, that's right. It's very important to see that, the susceptible population, especially the elderly people and people who have got the comorbidities, people who have got COPD, asthma, people who have got, any kind of immunosuppressive illness, who are undergoing chemotherapy, people who have got chronic health issues. These are the people who are more predisposed to the effects of air pollution. And especially the children and adolescents, they are also very vulnerable to the toxic effects of the air pollutants. So these particular populations should have a proper planning. We should have a proper planning for these set of population. They should take all the precautions necessary to prevent the ill effects of the air pollution. Yes.
Right, sir. And if you could just elaborate a little bit on what people can do and what hospitals can do as well to improve the situation.
See, number one thing is the elderly and geriatric population and the ones who are predisposed, as I said, the ones who have got comorbidities. Not only the lung-associated comorbidities, but even the cardiovascular, the people who are diabetics, who are long-term hypertensives, people who have got associated coronary artery disease, any heart attack in the past, or the lung illnesses, as I said. These patients and geriatric patients, any patient who is, any person who is more than 60 years in age, these people should, understand that, they have to take precautions in terms of, they should wear masks all the time when they're out in the public. And also at the same time, they should do the deep breathing exercises at home, especially in this coming season. This will strengthen their lungs. The regular exercises like Anulom Vilom, the deep breathing exercises, spirometry at home, they can keep that small, simple spirometer at home. That is very handy, comes at 1,000 rupees cost, nothing. And they can keep blowing that, that can improve their lung health. The same time, steam inhalation once in a day in the morning, that keeps the airways moist. The geriatric population and at-risk population should ensure they should get pneumovac and the flu shots, every season. This will ensure that they don't get any additional infection. The air pollution can just compound the ill effects of any infection, lung infection. So all these precautions need to be taken by the susceptible population.
Right. Absolutely. Thank you, Bharti Chaturvedi and Dr. Rahul Chandola for joining us and sharing your thoughts on this story. We'll, of course, continue tracking the story as it develops. For now, a short break.